Good morning, good afternoon, and a good evening from whichever part of the world you all are joining us. Hi, this is Dr. Gaurang Raval, and I am a member of the Emerging Trends Committee of Asian Oceanian Society of Radiology. Today, we are hosting our first ever sustainability webinar in AOSR. Basically, the Sustainability Working Group of AOSR is the flag bearer of the entire movement, and it has been started by Dr. Evelyn Ho. And I clearly remember before a year or two when we were in Taiwan in our AOSR annual conference, she was very much concerned about the sustainability issues and how and what radiologists can do. And then it took a definitive shape this year in the formation of the Sustainability Working Group. But for now, the Emerging Trends Committee will be just helping them out. And before we begin anything, we have the full support and blessings of Dr. Chamari, who's our president of AOSR. And I would request her to say a few words for this webinar and this movement. Over to you, Chamari, ma'am.
Thank you, Dr. Garang. Dear colleagues, esteemed speakers, and honored guests, it is my privilege to welcome you to today's webinar hosted by the AOSR Emerging Trends Committee in collaboration with the AOSR Sustainability Working Group. This event reflects our society's growing commitment to addressing the environmental, social, and systemic challenges facing healthcare today. We are honored to be joined by a distinguished panel, Dr. Evelyn Ho, Dr. Omary, Dr. Hideki Ota, and Dr. Lingzhi, who will share global perspective and practical strategy for advancing sustainability in radiology. I also would like to extend my appreciation to Dr. Garang Ravel for moderating today's session. Before we begin, I would like to acknowledge the sudden and recent passing of Dr. Hemant Patel, our esteemed AOSR Honorary Secretary. Dr. Patel's leadership and dedication to international collaboration have left a lasting legacy. We honor his memory through our continued pursuit of excellence and innovation. Thank you for joining us in this important dialogue. Let's now begin.
Thank you, Dr. Chamari, for your kind words. And without much ado, let's get on to our first talk. Can I have the introductory slide for Dr. Evelyn, ma'am, please? Dr. Evelyn, ma'am, is our past president of AOSR. She's a consultant clinical radiologist at the Park City Medical Center, Kuala Lumpur, Malaysia. She is the founding chair of Sustainability Working Group. She is the honorary advisor and past president of AOSR. She's honorary member of RSNA, ESR, CSR, IRIA, and honorary fellow of HKCR and ACR. She has been the past president of College of Radiology, Academy of Medicine of Malaysia. She is the past chair of RSNA Regional Committee of Asia Oceania. She is the member of RSNA News Editorial Board. She is a staunch advocate of breast health, palliative care, and more recently, sustainability and radiology. She is a mentor to many young radiologists like me. Over to you, ma'am.
Thank you very much, Gaurang. Is environmental sustainability in radiology something that we should focus on when we have to address access to care for more people in the low and middle income economies? Shouldn't the Asian Oceanian Society of Radiology, the AOSR, be more concerned with improving our abilities to interpret imaging examinations and perform procedures, save lives? Yet overuse of medical imaging occurs also in the lower middle income countries. Don't we need to address this? How is overuse or inappropriate use related to greener or sustainability in radiology? Hi, everyone, and greetings from the AOSR. As Gaurang has very kindly said, I'm Evelyn Ho and past president of the AOSR. There is more to sustainability than meets the eye. Did you know that idling MRIs overnight costs millions? I didn't. When I first got involved in environmental sustainability in radiology or green radiology, I felt I knew nothing and wasn't sure how I could contribute to this arena. But I was very quickly reassured that we are all relatively new to this and learning together. There is more to sustainability than meets the eye because it is inextricable from the economics of practice, aka surprisingly financial savings. Justifiable or appropriate imaging and procedures will have better outcomes for the environment and for the operators, including radiologists. Think workload, the patient, and all humankind, as Reid Omary will soon talk to us about. The hope is you will walk away from this Introduction to Sustainability webinar excited about the possibilities for sustainable radiology and what each of us can do still, even when there are no formal policies or programs from higher up, whether it's your department, your hospital, state, or even country, to make radiology more sustainable. And maybe some of you out there will be a sustainability champion in your department or medical center. We are all learning together on this road. It is so crucial that we share what we know and what worked for us wherever in the world we are. I found out how friendly the sustainable community, radiology community is, and the champions that there are. And if you needed help to establish an energy dashboard, for example, that the center got working after many years, they are just an email away. So where is AOSR in all of this? Stay with me for the reveal. For our attendees who are not from the AOSR, as of today, we are a federation of 24 member societies in Asia, Oceania. In addition, we have island nations of Tonga and Fiji who are just considered individual members as there are just too few radiologists to form a society. We also have a handful of other individual members, mostly the Asian Oceanian diaspora worldwide. We have no low-income economies amongst our membership. Asia is the biggest continent in the world where 60% of the world's population lives. It covers a very large area, is colorful and diverse from many aspects, socioeconomic status, large area, and languages, and even our carbon footprints. The reason being, our population size, income levels, energy use, consumptions of goods and services are so uneven. Now, carbon dioxide is a primary greenhouse gas, and compared to other greenhouse gases such as nitrous oxide, methane, and fluorinated gases, it lingers longer in our atmosphere and is therefore been described as a blanket. Therefore, we often use the carbon dioxide metric because it is more easily measured and monitored. The so-called carbon footprint to calculate our emissions so that we can understand the factors contributing to it, develop and tailor approaches to each country's unique national circumstances. There is no one-size-fits-all. Sustainability, of course, is more than greenhouse gas emissions. We talk about the ecological footprint and the human demand on nature, which includes food, water, materials, and waste. So on this slide, you see the average global per person carbon footprint per year. And that's 4.7 metric tons of carbon dioxide equivalent to driving an average SUV for 18 months or 2 round trips of flights between New York and Singapore. Medical imaging contributes to 1% of global greenhouse gas emissions. And I present data from a cross-sectional retrospective analysis of total greenhouse gas emissions for diagnostic radiology tests at an academic Canadian medical imaging department covering 3 hospital organizations serving 5 hospital sites over 5 years from 2018 to 2022. And the department includes medical imaging equipment from multiple vendors. X-rays and ultrasound accounted for 34% and 18% of the number of tests, but only 4% and 3% of the greenhouse gas emissions. On the other hand, MRI was the largest contributor to greenhouse gas emissions at a whopping 41%, even though it only contributed 12% to all the number of imaging tests, with CT being the next highest in greenhouse gas emissions. These are really many times that of the humble chest X-ray, or the X-rays, not just the chest X-ray, and ultrasound. So keep in mind that if ultrasound will give adequate information, use that instead of CT or MRI. I personally believe that LMICs have an edge. because we have a chance to start sustainably. There is a tendency to use diagnostic services more judiciously because of cost and availability, and there is less idle time for scanners because we don't have that many. They may not have a legacy, may not have legacy equipment to dispose of. They need to use equipment to the max because of, again, lack of financial resources, and therefore have a longer replacement cycle, which is in fact more environment friendly. Therefore, there is really no shame in using equipment for as long as it's practical and with good maintenance contracts. If you are buying in this period, that means more options for eco-design features, and we will hear more of this from Dr. Lance Hu. There is an opportunity to learn from high-resource countries with more high-energy consumption scanners per million population. Within Asia, Oceania are some countries with a very high density of MRI and CT scanners per million population. I look for scanner density for all the countries from which AOSR members are from, but to lessen clutter on this slide, I show just a few of the highest density to the lowest density to demonstrate the very wide disparity in Asia, Oceania. AOSR have member countries with 0 MRI to the highest MRI and CT scanner densities in the world. Japan outranks others globally by far and by a very big margin too from the next highest in density, shown as well on this slide, even if not from Asia, Oceania. There are other countries with high density scanners, and if you are interested, do check out the sources as I have mentioned it on this slide. And if you remember the earlier slide on greenhouse gas emissions by imaging modalities, MRIs particularly and CTs are high energy consumption equipment with large carbon footprints in the department. How does Asia Oceania fare on the energy efficiency? Whilst metrics for this scorecard does not specifically pertain to that of diagnostic imaging, it is encouraging to see the larger scale efforts to improve energy efficiency in Asia Oceania. Published by the American Council for an Energy Efficient Economy, this 2022 scorecard evaluated 25 countries in the world that consumes 82% of the energy on this planet. And they were evaluated based on 36 categories across 36 metrics across 4 categories of buildings, industry, transportation, and national efforts. While Japan may have the highest density of MRI and CT scanners in the world, they are also the highest energy efficient country in Asia Oceania. Perhaps by now everyone can see why we in the AOSR should care about environmental sustainability. To find out the level of sustainability awareness and practices, the AOSR sent out a short questionnaire in July 2024 to our AOSR members, conducted within a short span of 2 weeks, literally a pulse check. 71% of our society members and 50% of our individual members responded to this very short series of questions, half of which were open-ended to enable free text responses. The society respondents were either the president or the authorized delegate. If categorized by World Bank gross national income, then our respondents were about a third each from lower middle income, upper middle income, and high income regions. About 1/3 and 40% worked in departments and hospitals with some form of sustainability program or policies respectively. And about a third did not have such programs in their departments, while 20% did not have it for the hospital. Some were in the planning phase, and of course, some were not aware that whether such a program existed. As for the radiological societies, about 60% had sustainability or at least started such initiatives. And this range, of course, from green congresses, holding talks with vendors so that they will build their booths sustainably and not provide plastic bags, conducting educational programs, working with appropriate government agencies to set up national SOPs, going digital, even in training, exams, and logbooks. I thought that was really interesting. And reducing repeats, encouraging everyone to optimize their imaging protocols to avoid unnecessary, number 1, radiation dose, and 2, imaging, and also reduces waste when you use less imaging. Guidance on managing waste, as well as formally setting up an ESG committee. The open text responses we receive with regards needs, challenges, and other comments from the July 2024 Pulse Check are summarized in the next few slides. As in all situations, there's always never enough money, time, and human resources, resulting in challenges buying eco-friendly equipment, even going digital. In fact, one respondent said they were still using chemical film processing, while another had digital systems that kept breaking down. Therefore, let alone access to renewable energy sources. Grants for research in sustainability were either lacking, or if not lacking, then needed to be promoted. Lack of know-how on how to benchmark, how to measure energy use were cited as well. Government, hospital, and department policies were lacking to ensure sustainable practices. Clear guidelines were also lacking on waste reduction and recycling, and stock control to reduce wastage from expired items or overstocking. And what about safe disposal of radionuclides? The next set of challenges were competing priorities and conflicts of interest. Competing priorities and conflicts of interest, such as infection control versus the use of single-use disposables, which are creating a lot of waste, or the fact that actually single-use disposables may be cheaper and more convenient because it's less time-consuming to repeatedly disinfect, or in the case of multi-use injector, which is expensive to acquire, and you can't justify when you already have an existing CT contrast injector. What about medical legal concerns? When patients perceive you might have shortchanged them by using a lower carbon footprint modality such as ultrasound instead of CT or MRI. Is adequate information enough or more information? Obviously, more education for all, including the patient, is needed when it comes to appropriate imaging. And of course, profits versus inappropriate imaging, it's self-explanatory, especially in private institutions. And how does one recoup investment in taking measures to go greener? Green radiology is a sustainable, innovative, and responsible approach that focuses on minimizing the negative environmental impact of technologies and procedures. And after the July 2024 Pulse Check on sustainable radiology in AOSR, we set up the Sustainability Working Group. The SWG has a mission to promote awareness, thought leadership, and best practices in sustainable radiology. Sustainability was originally under the purview of the AOSR Emerging Trends Committee, as Gaurang has mentioned, which is why Emerging Trends is a co-organizer of this webinar. Emerging Trends Committee will continue to support the SWG efforts moving forwards. We conducted a second more in-depth green survey from October 2024 to April 2025. We had 15 Radiology Nuclear Medicine Society responses and 123 institution responses, out of which 82 were from Japan. And we will hear more of this from Dr. Hideki Ota later on. We have analyzed the data and in the process of writing it up. Use the as low as reasonably achievable ALARA principles in radiation safety and extend it to sustainable radiology. This puts practicing sustainable radiology in more familiar territory for radiologists. The first sustainability track created in the Asian Oceanian Congress of Radiology was in AOCR in Chennai, India in January this year. By encouraging a category for sustainability-related paper or poster submissions in every annual meeting of each of our societies and that of the AOCR, we hope to promote research and case studies sharing. Unfortunately, the AOSR does not have the resources to award research grants. Today's webinar is Energy-Related Conversation in Action, and we encourage energy conversations informally or formally among all our AOSR members. AOSR is involved with other organizations with the eventual aim of having local impact on our membership. And one of these collaborations was with multiple societies globally to write the now published paper on sustainability in radiology, position paper, and call to action. This was led by Andrea Rockall, then president of ESR, and published simultaneously in 6 journals just before the ECR this year in February. I encourage everyone to read this and take your pick from any of the journals. It is open access in European Radiology, KJR, and free access in Radiology and the rest of the other 3 journals. AOSR is also participating in the ISRRR initiatives, and it started with value-based radiology, VBR retreats in 2021, and then the VBR steering committee, and now a sustainability registry. So what are our take-home lessons? One, there is definitely more than meets the eye in sustainable radiology. It will save you money, reduce unnecessary workload, alleviate workforce shortage, and save our environment in that process. Number two, it is not only a high-resource region problem, it is everyone's business and responsibility, particularly in Asia-Oceania with some of the highest density, high energy consumption modalities of CT and MRI. Many Asian middle-income countries are also included in the top 25 countries that consume 82% of the world's energy, which I did not manage to show earlier. And this is not unexpected because we have some of the most populous countries in Asia. Three, you can start now with individual action, as easy as turning off your workstation when you are done or when you're not using it, and not performing an inappropriate examination. The most sustainable radiology practice is the one that you do not do. And four, remember, you are not alone. We are all learning and in this together, and together we achieve more. With that, I leave you with this poster of our next Asian Oceanian Congress of Radiology, hosted by the Singapore Radiological Society from the 20th to 23rd of August 2026. And the theme is Imaging Beyond Borders, Shaping a Sustainable Future. Thank you very much and see you at the AOSR 2026.
Thank you so much, Dr. Evelyn, ma'am, for such an insightful lecture. And I think ma'am gives a gist of all the hard work she has done since the last 2 years of starting this working group. Really grateful. I would like to request the audience to log into the chat box, post any questions. You can post anonymous questions also. But we like your feedback and we'll be flashing the QR code for you to give feedback. Also, someone from our team will also be posting a link in which you can give the feedback. Your feedback helps us to make these CMEs more interesting. So I clearly remember that when we were planning this webinar and we had long conversations with Dr. Evelyn, what to name it, and we named it the first steps in radiology. We needed somebody to help us hold our hands and guide us in these first steps. And there is one person which unanimously comes to our mind, and he is none other than Dr. Reid Omary. Can I have the introductory slide for Dr. Reid Omary? Dr. Reid, sir, is a legend in the world of sustainability. And I'm really thankful that he is here with us today. He's the professor of radiology and biomedical engineering at Vanderbilt University in Nashville, USA. He was the chair of radiology from 2012 to 2023 in the university. He was past president of the Association of Academic Radiology and past president-elect of the Society of Chairs of Academic Radiology Departments. Dr. Omary has pivoted his career into sustainable medicine, launching the Green Leap blog in 2023 and founding a 501 non-profit organization called Greenwell Project. These are the links of these websites. And without much ado, I would like to invite Dr. Reid Omary to deliver his lecture. Welcome, sir.
Thank you. Thank you so much. I'm really honored to be here. And I think this is a fantastic way to consider how we are all in this together. And today, you know, I'm from the United States. The topic we're addressing really affects every single living person today, all 8 billion people on the planet. What I would like to do is discuss the concept of planetary health and explain why it matters to the field of radiology and to our patients. And this is such an honor to be with you, the AOSR membership. I would like to dedicate today's session to all the children in the world. And when we look the rest of this century, there are going to be 7 billion more children born. And so all the actions we take today, like compound interest, will have a much greater effect on them. So I have a few disclosures as I've shown here, and I'd like to begin with a story. This story came from last week. I was very privileged to attend the Galapagos Islands outside of Ecuador with my family. This was a once in a lifetime trip, and provided me the opportunity to see how natural selection and evolution works. And you see right behind me, Daphne Major. It's one of the most, it's really uninhabitable as an island in the Galapagos. This is fundamentally the place where what have been termed Darwin's finches were really proven to undergo natural selection and evolution. And natural selection is the process of adapting to our local conditions, whether that is access to food or extreme weather, other resources, whereas evolution is how we take those adaptations and transmit them to subsequent generations. This is a very practical framework to consider in terms of the health of the planet and sustainability, and what we can do in terms of radiology and the healthcare field. So I would like to use this lens to consider all of the work we do and the challenges that we're facing. What I learned while being in the Galapagos is that the smallest change, the ability to adapt to extreme weather for the finches, and just making their beaks go from 9.5 to 10 millimeters provided them an incredible edge to be able to continue to survive. And so that same sort of perspective is present in terms of imaging. So what is the adaptation that is required? And when we look at the World Health Organization, the single biggest health threat facing 8 billion people today is climate change. It's not COVID, it's not a new infectious disease, but in some, it is our changing climate. And I want to talk a little bit more about that. Our climate is, the changing of our climate is due to human-caused use of fossil fuels. This is not a controversial topic in terms of the science. It is a controversial topic in terms of having to restructure how we acquire our energy. And when we think about access to energy, we can use power as a synonym, but the power is more than just in terms of the energy. The power is in the ability to have successfully advanced economics within societies. The relationship of fossil fuels to our planet's health is the exact same relationship as smoking to the human body. And I wanted to showcase this in terms of generating this art, which was on the December cover issue of the Journal of Climate Change and Health. Right now, 3/4 of all emissions that are present in our world, all the pollution that comes from carbon sources, is due to fossil fuels. These fossil fuels each year cause 5 million premature deaths across the world. 5 million. These are like COVID level numbers. And I'd like to emphasize that, like smoking, it's really going to take us a full generation to try and switch our societal norms. It used to be when I was a kid, I remember if I went on an airplane, smoking was allowed, and then there were smoking and non-smoking sections, and then eventually they got rid of smoking. We're going to see the same social and cultural changes occurring with fossil fuels. It doesn't happen as an event, it's a process. And as I mentioned, the pollution that comes from the burning of carbon sources, it goes into the air. And when we look at our parts per million of atmospheric carbon, they've risen dramatically. In fact, they're the highest level that they have been in 800,000 years. The carbon itself, think about it as it's like a blanket that keeps and warms the planet. And when we see this, it can be exhibited in these stripes. So if we go back to 1850 and consider that the start of the industrial age, as the temperature has increased, it's shown more in red, and you can see a dramatic change in increased worldwide temperature related to the increase in carbon. So we have pollution that extends into our atmosphere that has led in the last 10 years to have the 10 highest recorded levels of temperature in recorded history. And specifically in 2023 and 2024, they were the hottest years on record. And when we look at the increase in temperature, Asia right now is warming at twice the global average, according to the World Meteorological Society. So what does this mean? It translates into extreme weather events. Right now, this week, South Korea is having horrific torrential rains. We can see flooding in many parts of Asia, Oceania. We also recognize that there are rising sea levels affecting the survival of some of islands in Oceania. And we know that when we look at Indonesia, the risk of rising sea levels is so much that there will be a transition in the location of the capital. So we cannot run away from this, and it is up to us as physicians, as members of the healthcare industry, to consider ways to link changes to the planet to human health. And that comes to this notion of planetary health. And there's a lot of terminology that's present. You'll hear planetary health, you'll hear global warming, you'll hear sustainability, climate change. I want to take a step back and just speak about nomenclature. Climate change is one of the components of planetary health. Health of the planet is related to the health of all living species, which humans are one of at least 2 million living species. When you think about global health is defined by nation states. Planetary health goes beyond that. There's no nation states. It's just the health of the planet, which includes all the species, as well as the geochemical processes. When we think about planetary health, We are decentering humans. And just like when we think about Darwin, we were decentering humans. And just like we think when we go back to Copernicus, we were no longer saying that the Earth was the center. So these are concepts that take a while to get into the normal accepted mind frame of humans. Sustainability is reducing waste. Climate change is one component of the health of the planet. We also have increased plastics. We have the change in the ozone layer. We also have significant losses in biodiversity. So all of these come together to affect the health of humans. And when we look at planetary health, you may think this seems abstract. How is this directly affecting us? I would like to refer to the World Economic Fund. They each year have a meeting in Davos, Switzerland, which invites the leading I would say money makers in the world. These are individuals every January who descend upon Davos that control the world's finances. If the Nobel Prize was awarded to people who can make money, it would be awarded to those who attend Davos. And when those members are surveyed and asked what are they most worried about in terms of protecting their money, it is related to the health of the planet. We look right now, obviously misinformation and disinformation, extreme weather events are the top two right now. But when we look at the next decade, the top four are all related to planetary health. And when we look at 1/2 of the top 10 major risks for protecting the financial systems of the world are related to climate change, extreme weather events, loss of biodiversity. So this absolutely matters. And we in radiology, as Dr. Evelyn showed, we're major emitters of carbon pollution. And this was a study we performed at Vanderbilt together with Philips, and we looked at the carbon pollution that comes out over the entire life cycle, from manufacturing our scanners all the way to using them. And MRI, no question, is the main energy hog. It's half of the pollution that we emit. I will emphasize, if you have scanners, just like if you have a fossil fuel-based car, there's initial resources to construct and manufacture it. So do not think that, oh, I need to get rid of this. Use it until its maximum end, as Dr. Evelyn mentioned. We also, this is very important when we think about healthcare, what our patients think about sustainability. And we conducted this research here in the American South, which is amongst the most conservative regions of the United States. And what we found is that 90% of our patients were aware of harming health from pollution, and that 3 out of 5 patients prefer eco-friendly clinicians compared to equal quality clinicians who are not eco-friendly. Also, there's a tremendous global healthcare workforce shortage. 10 million people right now, and we need to address this because we have our boomers are retiring and they're not being replaced enough by Generation Z. And when we look at the generation that cares most about climate change, it is Generation Z. These are folks who are between age 12 and 28. And this sign really summarizes their sentiments. So we have the capacity to recruit better when we consider human health and planetary health as connected, because we can bring more people to enter healthcare as a field because of their interest in combating climate change. So what do we do next? I give two very practical asks. One is, if you have a busy CT scanner and you are not using multi-use contrast agent, please consider changing. You will not only reduce the pharmaceutical waste and the plastic waste, you will have incredible savings. We studied this at Vanderbilt, and we showed that with 6 CT scanners, we had modeled this out, it would save $500,000 a year. We actually then have studied it, and in fact, we were wrong, because it wasn't 6 CT scanners that saved $500,000, it was 4 CT scanners. My second ask is to de-risk your supply chain. If you have a single source for your products and they come from one location, and that location is hit with severe weather, it could be a flood, it could be a typhoon, it could be a geopolitical conflict. If you do not have access to another source of those critical supplies, like in this case, intravenous fluid, it's not possible to deliver healthcare, and our patients depend upon us. So look at your supply chains and see if you can have more than one source for the critical agents that you use. And so we really find ourselves with two futures, and going back to the concept of Darwin, we can continue doing what we're doing right now. And unfortunately, that's going to place us at greater and greater risk. Alternatively, we can start adapting for these severe changes that we know are happening, and think about ways to embed sustainability into our practices. And if we all start doing this now, we can then look and adapt to these significant planetary changes and help our patients, communities, and planet thrive. So I thank you all for your attention. It's been an honor to be here today with you.
Thank you so much, Dr. Reed. Omary sir, it was really very, very interesting. And not only for us as professional radiologists, but anybody who is ever connected to radiology will be inspired. What small things, what small steps like using a multi-use contrast agent can give such positive outcomes. And in today's world, money speaks. So it's very economical also. And I would like to request the platform to share the QR code for a few seconds so that our viewers can share their feedback. Also, I request all the viewers to post in your questions in the chat session, so that when all the 4 talks are over, we can bounce them off to the speakers. Thank you so much. As Dr. Evelyn ma'am was discussing, Japan is a very interesting country. It is one of the most developed countries in the Southeast Asia. And they are not only leading the highest consumption of radiology equipments, at the same time, they are taking very many positive steps towards a sustainable radiology. And to share their experience, I would like the next topic. Can we have the next CV slide, please? It was a great honor to us to have a representative from Asia Oceania, especially Japan. And we have Dr. Hideki Ota. He is the professor in Department of Diagnostic Radiology, Tohoku University Hospital, Japan. He's the delegate of Japan Radiological Society. He's the vice chair of JRS Sustainability Committee. He's the board member of Society of Magnetic Resonance Angiography. He's the trustee of Japanese College of Angiology. He's the delegate of Japanese Society of Interventional Radiology. He has published over 100 manuscripts in peer-reviewed English journals. And his academic interests are cardiovascular and pulmonary vascular imaging, 4D flow MRI, and interventional radiology. I would like to invite him to give us an overview of the first steps towards sustainability in AOSR countries.
Thank you. Thank you for kind introduction. Can I see my slide? Yeah, I think so. Okay. My name is Hideki Ota, and thank you for the introduction. I'm very honored to have been given the opportunity to speak today. I'm at AOSR Sustainability Webinar. Sorry. Okay. I'm a radiologist specializing in cardiovascular imaging and interventional radiology. And this is my disclosure. Here's my agenda. I think that my talk will be overlapped with some previous talks. First, in the introduction, I will briefly introduce the concept of planetary health probably in different words and sustainable healthcare. Then I will proceed with the topics as outlined here: climate change and carbon neutrality, carbon footprint of healthcare, green radiology practice, and summary. And also, I will introduce some challenges, actually, that are specific to Japan. As Dr. Omary mentioned, there's a word called planetary health. In 2015, the Lancet Commission defined planetary health. The planetary health is the health of human civilization and the state of the natural systems on which it depends. Furthermore, what do we mean by the sustainable healthcare? It is an approach to healthcare that aims to minimize the negative environmental impacts while meeting the health needs of both current and future generations. We have traditionally prioritized human health, but we must now consider that human health and health of our planet mutually affect one another. This idea is supported by a recent position paper led by Professor Local, as Dr. Evelyn mentioned. It outlines key actions that radiological societies should take to achieve sustainable radiology. While these efforts have already gained momentum in especially Europe and North America, in Asian countries, I think that we are just at the starting line. So our first step must be to understand the challenge and commit to action. The next is what's happening in the global environment. This is the graph as Dr. Omary mentioned, but so the global mean temperature is rising year by year, and especially since around the year 2000. And these days, there has been an increase in the unusually warm years with steeper upward trend. The impacts of global warming are closer than you think. Further intensification of rainfall and shifts in rainfall patterns are anticipated. We have more and more chance of heavy rain here in Japan and the Asian country as well. And heavy rainfall can cause regional flooding and damage high-cost medical equipment, such as MRI and CT, as shown in this Japanese newspaper after record high heavy rainfall. In fact, 30% of hospitals in Japan are at risk of flooding. So mitigation and adaptation are both essential countermeasures for global warming. Adaptation is particularly vital for enhancing facility resilience these days. Are targeting carbon neutrality by 2050, some by 2060 or 2070. In Japan, our progress towards net zero by 2050 is shown as shown here. Although we saw some increases in carbon emissions, probably due to several factors, including the COVID-19 situations, the overall plan is proceeding as intended, though future success remains unknown. This is a Japanese governmental infographic showing various carbon dioxide reduction initiatives in industry and daily life. Notice, however, that the healthcare sector is not mentioned here. Should we ignore the healthcare sector's carbon emissions? Absolutely not. Some may refer to the healthcare sector as a don't touch sector, yet its greenhouse gas emissions account for around 5% of global emissions in major countries and around 8% in Japan. These emissions result in over 3 million disability-adjusted life years lost, and it's comparable to the annual emissions from more than 500 coal-fired power plants. If a healthcare sector were a country, it would rank as the 5th largest emitter globally. In the top 10, major OECD countries and the EU account for 75% of global emissions, with Japan ranking 4th after the EU. When we look at per capita health carbon footprint, Japan still remains high as shown in blue color. Here is the carbon footprint of healthcare services in more detail in Japan. Although it is from pre-COVID years, data indicate that emissions have been gradually increasing over time. Comparing healthcare carbon footprint for those under and over 65, the elderly group shows much higher usage, especially in fields like cardiovascular disease and neoplasm. Given Japan's rapidly aging society, even with a slight population decline, the carbon footprint is expected to increase unless any actions performed. Of course, Japan is not alone. Many countries in Asia and Oceania are also facing rapidly aging populations. The next is about carbon footprint of healthcare. As previously mentioned, the radiological services have various environmental impacts, including energy consumption, waste generation, and use of finite resources such as helium gas, iodine, and gadolinium. Medical imaging generates about 1% of total greenhouse gas emissions. These factors not only contribute to climate change, but also affect our health through increased risk of diseases such as cardiovascular and respiratory diseases, and higher cost of healthcare services. The green radiology refers to the practice of radiology focusing on environmental sustainability and the reduction of waste derived from our daily activities. Green radiology practice aims not only to protect the environment, but also to reduce costs in healthcare services. For example, let's consider the energy consumption of CT and MRI scanners. At University Hospital Basel, data showed that the University Hospital has 3 CT scanners and 4 MRI scanners, performing around 40,000 examinations annually. The annual energy consumption is enormous, equivalent to power consumption of about 210 households. For instance, one MRI unit consumes energy equivalent to 40 households and one CT scanner to 5 households. Here are energy consumption patterns of CT and MRI. CT scanners show pulse-like energy consumption during image acquisition, whereas MRI consumes a high proportion of energy even during idle times. It is estimated that approximately 2/3 of CT energy consumption occurs during idle time, and for MRI, even when turned off, about 1/3 of the energy is consumed. In other words, roughly half of the energy is used non-productively. Here are variations of imaging modalities in energy consumption. Reducing idle energy consumption by shutting down systems when not in use could lead to significant savings, although it depends on imaging modalities. This is a survey of radiology residency teaching hospitals in Japan. And this indicated that approximately half of the CT and MRI facilities were equipped with and incorporated such system-of-state capabilities. Perhaps we could step further with energy consumption reduction initiatives from this data. Now, I would like to introduce the utilization and distribution of CT and MRI scanners in Japan. Both CT and MRI exams are performed at a high rate in Japan. In fact, Japan has the higher per capita number of CT exams globally and the second highest MRI exam rate after Germany. However, looking at the number of exams per scanner by country, Japan has the lowest number of exams per CT and MRI unit among developed countries, which indicates that Japan is underutilizing its scanners relative to their full capacity for examinations. These are distributions of CT and MRI unit counts and scan volumes by region in Japan. Each dot shows a smaller region in Japan. And in areas where there is a higher density of CT or MRI units per 100,000 population, the utilization per unit tends to be lower. This suggests that consolidating equipment could improve energy efficiency, even if the overall number of exams remain unchanged. This is shown in the previous talk, and a life cycle assessment. This life cycle assessment shows that CT and MRI account for significant share of greenhouse emissions. But radiologists are also interested in the PACS system used in the daily practice. Actually, PACS contributes to 11% of greenhouse gas emissions in radiology department. One academic hospital, 36 radiology reporting stations have energy consumption roughly equivalent to 12 households. Idle time accounts for 50% of total energy consumption, and turning off systems after 1 hour can save up to 40% of energy. Focusing on reading during the day and leave on time is variable for environmental impact. This also aligns with ongoing efforts to reform physicians' work styles, as many of us face heavy workloads and the risk of burnout. Actually, there are many stakeholders in green radiology, including vendors, governments, professional organizations, and physicians. However, we must prioritize patients' perspectives. According to the UK resident survey, while the public broadly supports sustainable healthcare, support weakens when their own treatment and care are directly affected. Therefore, ensuring quality, safety, and equitable access to healthcare is essential. Research also shows that the more patients learn about the impact of climate change on healthcare, the more supportive they become of sustainable healthcare. Thus, public promotion and education are key. How about appropriateness of imaging tests? This slide shows one way to consider appropriateness across multiple dimensions. First, the medical benefit is paramount. Then, hospitals and society consider economic costs, radiological risk, and radiation dose. There is also a chance to factor in environmental costs. Avoiding unnecessary tests through initiatives like choosing wisely also contributes to environmental sustainability in the end. What is happening in interventional radiology suite? The climate control system consumes the most energy, over 50% even during off hours. The second highest is the production and transportation of single-use supplies, with municipal waste being the largest contributor. Aside from necessary waste like biohazard materials and sharps, we should consider actions to reduce general waste in IR suites. Many interventional radiologists recognize the environmental impact of their work from the study in Netherlands, yet actual actions are often limited. Barriers include the structure of the organization, not knowing where to start, no alternatives for disposables, lack of time, and impeding rules. In our institution, by shifting from barcode and paper-based tracking of radio frequency ID, RFID, we have streamlined the management of disposable medical devices in our cath lab. This allows seamless data capture from logistics to charting and billing without requiring manual documentation. The system not only reduces documentation errors, but also potentially contributes to green radiology by cutting paper waste and optimizing device usage. Additionally, automation helps mitigate the workforce shortages by reducing manual tasks and improving operational efficiency. Here's Roger's diffusion curve of innovation. In green radiology, we are currently in the early phase with our only few innovators and early adopters. Expanding this base is a mission we have as a society. That is why the JRS Sustainability Radiology Committee has been officially launched this year. We have established our vision and mission as shown. Our vision is to lead the realization of sustainable healthcare through the harmonization of radiology with the global environment, ensuring the health of patients and future generations. Besides environmental impact, the healthcare system as a whole is facing multiple ongoing and emerging challenges. An aging population, workforce shortages, disparities in access, and increasing economic pressures, all of which are deeply connected to sustainability. It's about building a healthcare system that is resilient, equitable, and future-ready. These are also challenges our society must address. To summarize, healthcare, including radiology, significantly impacts the global environment. Adopt the planetary health perspective. Let's go green and reduce energy and waste in daily practice. Education and research are vital. Stay informed and foster awareness and knowledge sharing. Aim for greener radiology today than yesterday. And initiatives are needed at personal, departmental, hospital, corporate, and policy levels. In this context, radiology are uniquely positioned to lead green radiology efforts across all these levels. Thank you for your attention.
Thank you so much, Dr. Hideki. It was a really inspiring lecture for everybody. And Japan, as usual, is leading Asia and Oceania in taking steps towards a greener radiology. Moving on to the next talk. And when we were conceptualizing this, Dr. Evelyn was discussing with late Dr. Hemant Patel and myself, we were just thinking what would be the industry perspective towards sustainability in radiology. And then we requested Mr. Dr. Dilip and United Imaging Healthcare. And they were not only gracious enough to give us a lecture by Dr. Lance, but also support us in this movement of sustainable radiology that AOSR has started. So I would like to take this opportunity to thank United Imaging. And I would also like to invite Dr. Lance Hu. He's the Senior Vice President and Chief Technology Officer of United Imaging Research. He's the Fellow of American Institute of Medical and Biological Engineering. He's 2023 Distinguished Investigator Award for the Academy of Radiology and Biomedical Imaging Research. He's the lead for prospective research in medical imaging therapy, including new biomedical sensor development, multimodality imaging technology, and image-guided therapy systems. He's responsible for overseeing global scientific collaborations between UH and academic partners, and is author of over 100 journal publications and book chapters. He holds over 40 patents. So without much ado, I would like to invite Dr. Lance to share his views as an industry partner on what steps they are taking for sustainable radiology.
Thank you so much for the kind introduction. Is my slide visible?
Yes, sir. Yes, sir.
Okay, great. Yeah, thank you so much for the opportunity to share some of our vision with regarding to the sustainability of the overall radiology field as well as imaging. I think my personal attention to the sustainability and the global climate change actually come from our initiative when we started to build up the factory in Houston, Texas in 2017. A couple of our early engineers moved to Houston. And if you remember, in 2017, 1 in 100 years of flood in Houston is caused by Harvey hurricane. And including myself, many of our colleagues have their house flooded. That kind of give us a big warning, oh, the climate change is really happening. And it kind of trigger our thought, what we can do as a industry in the radiology field to help and remediate the climate change. So we look into the overall challenges of the sustainable future in healthcare. It's kind of astonishing to me to realize that the global carbon emission is going to be 6 gigatons, together with many other challenges such as professional shortage, population aging, as well as uneven distribution of the medical resources across the world. And I would love to call attention to this very informative paper, authored by Dr. Omary and many other colleagues in the field. In terms of the greenhouse gas emission caused by imaging, we have been thinking about the energy consumption during the scan. But in this paper, they highlighted that there were actually multiple stages that all contribute to the overall greenhouse gas emission, including the supply chain, including the energy consumption of the scanner, as well as packs, and together with many other facts that is downstream. And it really takes a team, including hospital administrator, physicians, governments, as well as industry, to work as one team to mitigate our gas and greenhouse gas emission. And in this talk, I would love to share some of my view on what industry can do to help in this scenario. My talk is split into four things I can think of industry can play a role in terms of sustainability in radiology. Number one is, as the designer of the scanner, we have the obligation to design greener product for greener radiology. And in terms of the workflow, well, it would be very nice to kind of reduce the scan time per patient so that we can have more scans done in fewer hours, so that we overall we save energy. And number three is in terms of the accessibility and the business model of the imaging service, we can think of how to share the imaging resource in a more reasonable way to minimize the people traveling from all across the region of the country and minimize the gas emission on the way. Finally, I think the workforce and talent education play a vital role here. We cannot address a challenge without seeing the challenge. So providing the necessary digital technology to allow physicians and decision makers to visualize the challenge and visualize the potential ways to address the challenge can make a huge difference. Starting from the green products, I would love to use MRI as an example to begin with. As many of the previous speakers have mentioned, MRI is traditionally one of the most energy-consuming imaging devices. Overall, healthcare takes 4.4% of the global climate footprint, and radiology takes 7.5% of that healthcare sector, and down to the one MRI. Maybe it's different literature, but it's somewhere between 26 up to 40 households that one MRI consume in 1 year. What industry can do to address this challenge? Again, we design the scanner and we have to embrace newer technology and the greener technology into radiology field. So one thing I think in terms of the MRI is that if you look at the major energy consumer in terms of the components, the gradient power amplifier is the most energy consuming one. Typically, it's somewhere between 2 megawatts all the way to up to 4 megawatts. However, there were new technology introduced in other industry, in automobile industry, that significantly reduce the energy consumption and increase the energy conversion rate. This new silicon carbonate technology can significantly increase the high efficiency with the same power drive, and offer high stability, better cooling, and of course, much lower energy consumption and less footprint in the scanning room. Also, it's worth mentioning that it would be nice, like every computer, we have standby mode, we have hibernation mode. It would be nice to introduce some of the energy consumption mode or eco mode in our MR system. For example, by introducing a standby mode, without compromising the ability to bring the MRI into action as fast as possible when there is a need, we can save up to 24% in energy per year with this newer developed standby mode. Also, it would be nice to have some nice control on and off of the scanner. One reason that most of the technologies, they are reluctant to turn off MR scanner is that turning on the MR scanner takes quite some time, somewhere between like 10 to 20 minutes. But if we can use AI or just some simple algorithm to time the time off and time on of the scanner, so the scanner can turn itself on before the first technologist get into the office, get into the scanning room the next day. That simple procedure by itself can save up to 12% in energy consumption of an MR scanner. Actually, that many of the urgent case needs to be sent over to CT. So we have to make sure many of the key components in the CT should be in action mode whenever there was a need. For example, if we compare the traditional idle mode versus the eco mode and the deep sleep mode, there could be a significant energy saving by putting a CT scanner into different modes in different scenarios. Also, it's not only energy consumption, it's also material consumption. Traditionally, the helium is one biggest material that is consumed in every single magnet. Typically, a MR magnet consumes somewhere between 500 to 2,000 liters of helium. And by introducing latest technology with better cooling to the magnet as well as high temperature superconducting, we can minimize the use of liquid helium and also a significant cost saving and material saving for the MRI business. Similar things apply to other modalities as well. PET-CT, for example. In the PET-CT, as you all know, the scintillator inside the detector consists of lutetium and cerium. All these rare earth elements, they are not only rare, but they also have high value. If we don't dispose them responsibly, they lead to heavy metal pollution. And also, they're expensive, so it would be a good idea to figure out a way to recycle this fundamental material, to use those lutetium from the old scanner to create new crystal and repack into a new PET-CT scanner. The material we used in the scanner needs to be very carefully examined. It's not only in the product itself, but it's also for the packing. For example, in the product, it would be nice to use as much as recyclable, sustainable material as possible. Right now, a typical good scanner, in our understanding, this industry, most of the industry player can achieve 90% of the sustainable product material. And also by putting a lot of attention to the details on selection of the material we use for the scanner packing and shipping, we can achieve 99% of sustainable packing materials when we transport the scanner from our factory to the hospitals. And all the scanners are made in the factories. We cannot have a sustainable business without a sustainable factory. There were two ways of minimize the energy consumption. One is to make the factory more energy efficient. We can improve the cooling, the AC system, the water cooling of the factory. That by itself can save all the way up to 910 million kilowatt hour per year. And on the other hand, it would be nice to introduce more greener energy into the factory operation, such as the geothermal heat pump, as well as maybe energy in the future from the wind, from other greener energy source. And aside from developing greener product, I think workflow also play an important role in making radiology more sustainable. Being able to scan more patients within a given time frame actually minimize the operational hour of the scanner, as well as it significantly improve the lifestyle of all the radiology personnel. There are a lot of AI technology these days, which we think can make a quite big significance contribution here. Saving scan time, in my view, equals to the reduction of the greenhouse gas emission. For example, in MRI, having AI-based acquisition, AI-based reconstruction, not only reduces scan time, but also can reduce the gradient power amplifier energy consumption and leads to significant reduction of the energy consumption of the MRI overall. This measure by itself can save up to 7% in energy consumption per year. And of course, we will never allow the imaging quality compromise happen with the save of the energy. We have to, I think the AI is ready to do that. Not let alone the large language model. I think maybe in the next 2 or 3 years, with the incorporation of additional large language model, all the industry can even achieve more higher acceleration factor here. For example, this is just a state of art. For example, we can achieve 50% reduction of scan time and energy just by introducing AI-based acquisition and reconstruction in a brain scan. The same principle applies, I think, to the CT and PET-CT as well. The dose reduction in the CT, as well as the dose reduction in the PET-CT, reduce the energy consumption, as well as the scan time, the overall workload of the patients. And another case is to use, traditionally, there were so many coils in the MR suites. Using one coil instead of many hot shell coils kind of reduce the material loss, material waste, also streamline the workflow, reduces scan time significantly. And incorporating some of the vision technology into some just simple camera inside the scanning room, having a one button push automatic head to toe scan, and we don't even need to turn on the laser point and push the patient into the specific scanning position. These simple measures to streamline workflow also significantly reduce the scanning time, patient on table, as well as increase the throughput of each of the scanners. So all energy saving measures put together still use MRI as an example. This adds up to 57% of energy saving for just every single scan if we are carefully designing all these latest technology, greener technology into a typical MRI. And another side of the, once the scanner is made, how to use a scanner, how to share the scanner among all patients is another big deal. This paper actually is very interesting and point out, compared to MRI and CT, actually the car travel, the patient needs to drive from their home to the hospital, the energy they consume on the way for them to travel to the scan takes even more energy than a single CT and an MRI. How to design the accessibility of the imaging device to all the patients seems to make a big difference. So one way to address that challenge is to put the scanner into a truck. This is very popular in the United States and is getting more popular in Europe and New Zealand, Australia as well. By putting a scanner into the truck, they can transport from hospital A to B to C depending on the real clinical needs. And also, if they don't have the infrastructure to build up a new shielding room for a newly built hospital or renovated hospital, having a truck or trailer parked on the side of the hospital also provide a good mitigation of the clinical workload over there. And post-processing also make a huge difference. If we have one button push post-processing, the radiologists and technologists does not need to spend like half an hour clicking buttons and minimize the energy consumption on the post-processing workstation as well as on the PACS. And having a fleet management software also provide a good overview of how we can manage the entire department better. So having this nice board for the leadership or the administrator of a radiology department so they can easily see how the scanners are being used, how much energy each of the scanner is consumed, and what is the energy consumption per patient. So all these key factors can give very informative decision and power to the chair, to the administrator of the radiology department. Last but not least, I think education always play a great role in terms of sustainability to bring awareness to the broader audience. For example, having the AR feature to visualize the different power consumption parts of a scanner, of a CT scanner, having a VR or AR technology to help the administrator to visualize the energy consumption of the entire hospital and visualize if they take one measure such as turning off the scanner at night, how much energy is going to be saved. Seeing the big picture will make a big decision in terms of sustainability in radiology. To summarize, from the industry point of view, I think we do have a very big responsibility to make sustainable radiology. To do that, we have to work with policymakers and the power supplier to develop the carbon neutrality plan, as well as having more clean electricity being used by our factory. We also need to work with hospitals, partner with our own suppliers to make sure these energy saving protocols are actually being deployed and all our components from our suppliers are actually sustainable. They don't contaminate the environment. And finally, we need to embrace the digital healthcare. It's an AI era. We need to bring the latest AI into action. how to leverage AI in managing the overall radiology field is a big topic, and we do see a huge potential over there. Last but not least, how to control the waste, how to recycle as much material as possible also play an important role. We hope we can recycle more material. Now we are trying to do that in PET-CT, and hopefully we can recycle a magnet superconducting wire very soon with the latest and greatest technology. With that, I'll thank you again for your attention, and would be happy to answer any questions.
Thank you so much, Dr. Lancer, for such an inspiring lecture. And it is really very heartening to see that a company like United is taking so many positive steps, right from the designing to executing in helping towards the sustainability movement throughout the world. And as we now come to end of our topics, I would like to kick off the discussion session. And for that, I would like to invite Dr. Chamari ma'am, Dr. Evelyn ma'am, Dr. Reed sir, Dr. Hideki sir, and Dr. Len sir. And Dr. Chamari ma'am, if you can ask a few questions.
Yes, thank you very much for all very interesting and inspiring lectures. A lot of new eye openers for me and I think for the whole team. Dr. Omary, I remember there's an agreement maybe a few years ago in 2015 from Paris Agreement on setting the goal of 1.5 degrees Celsius temperature. 10 years already passed. What is your opinion on how you're doing it? And can our radiology community involve more on reaching the goal?
Well, that's a great question, and I admire the goal, and the goal was really between 1.5 and 2 degrees centigrade, which on the surface doesn't sound like much, but it's actually enormous when we look at the effects. The way those numbers are considered, it's a 3-year running. So technically, while last year we were above 1.5 degrees for a single year, we haven't crossed the threshold yet. Dr. Chamary, I would bet my mortgage that we're going to cross 1.5 degrees. So it's really there's nothing magic about one single value. I think the important lesson is that we need to establish goals and do everything we can to try and reach them. And I would take China as an example where the economy is really becoming green. And we look at the investments coming out of China for electric vehicles, solar, and batteries. In China alone, those investments are as much as the rest of the world is investing in fossil fuels. So I am very optimistic that we're seeing a transition that's actually being led in Asia right now.
Okay, yes. One of my friends said that the human being is the only species that keep cooking ourselves. Yes, thank you very much, Dr. Omary. Dr. Ota, I think your comment on turn on and off of the medical device workstation is very practical. But to my understanding, when I learn about turn on and off, a lot of people say, no, you shouldn't turn on and off your laptop or computer. It will make your battery life cycle less. Is that the way that we should do the practice? Or is it only for the small device, but for the major equipment, just like a CT, MR? But CT, I also understand that if we turn it off and when we're going to use it, we need kind of a tube warming before we use to make sure that we save the tube life cycle. So it seemed to be a contradict between the practice for sustainability and how we're going to save our money on the equipment. Any recommendation on that?
Okay, thank you. I think that, for example, CT, of course, CT uses energy when starting up. So, and it takes some time, different from, personal computers. So, I think that in case of CT, like turning on in the morning and scan efficiently the patients with less idle times and scan very, very efficiently, then reduce the idle times. And when in the evening, just shut down. That will be the best way to do. And also, if you have multiple CT scanner, then try to shift the time of the starting up, because the maximum power can be shifted in a hospital, like 10 minutes or something. Then you can the balance, and you can reduce the maximum power consumption. So I think this is also one way to do. And in case of small based medical devices such as laptops, maybe you could make it in hibernate mode with less power consumption. If you are worried about the portable, battery life cycles and so on. But if you use just standard desktop PC or workstation, then maybe you could turn off for example, like in lunchtime or something. If you leave reading room for like 30 minutes or 1 hour, then try to shut down.
Thank you very much. I think there's many kind of pitfall on integrate sustainability lifestyle into our daily life, including practice with all the electrical devices all around us. Thank you very much. Dr. Hu, thank you very much for, it's very impressive. I didn't know that the industry in terms of the vendor has done so many work on the sustainability. And is it possible? Like, okay, if I'm going to buy an MRI, can I ask the vendor, okay, can you show me the carbon footprint on your product? Is that possible to add it as the one of the specification buying MRI or CT scan or any radiology equipment?
Yeah, I think that's a very legitimate request. But in the past, I don't think that's a standard in the configuration list. When you talk about MRI, typically you want gradient strands, field strands. But nowadays, we do, as a vendor and industry, we do see more hospitals. They care the energy consumption of the scan. So, for example, I can only speak for ourselves. In our latest product, we do put the energy consumption in different modes into our product specs. And we typically, when we do the training to our user, our application specialist also teach the user when to turn on the full mode, when to turn on the eco mode, and how to set up the timed on and off for the scan.
Thank you. Because I may need to ask more later with you, because now, as Dr. Evelyn has been mentioned on her talks, that there is a working group from AOSR that working on kind of a vendor registry on sustainability. So we try to find the topics of what should be registry, which is very difficult because there's so many aspects on in terms of equipment itself. But this is very, very eye-opener. Thank you very much. And I think Dr. Evelyn also have her own questions.
Yes, I was going to tell her.
Yes. So AI is a double-edged sword. Where do you see AI being more useful than right now is data servers? And I think Hideki Ota has showed us how much of tax is contributing to greenhouse gases. So we use a lot of cloud servers, a lot of data servers, and AI in particular uses a lot more energy than just the traditional one. So where do you see this panning out? So Lance and Ota, or even Reed.
I will give a try too. It's a very good question. I was sitting in the room of ECR talking about the green radiology a few months ago, and kind of striking to me to learn how much MRI equivalent energy that training a large language model would take. So typically, traditionally, we didn't talk about the energy used by this large language model when we call a AI algorithm on the scan. We kind of took that for granted. We think it's a free meal. But my personal view, that could be a very good study. We need to not only understand how much energy the scanner is costing, is using, but also how much energy when we use AI to give a selection protocol for us, how much energy is that? Because by the end of the day, the energy is not consumed in the room, it's consumed either in the workstation behind the scene or in a cluster and computational cloud somewhere.
Yes, I have a few questions, especially for Dr. Reed. This year in European Congress of Radiology, because it was the first time I attended, they gave those glass bottles to everybody, and I think that was a very positive steps in sustainability. We had planned something in India but could not achieve it. We had planned bamboo bottles. So do such kind of steps really help in the sustainability movement, or any other thing you would like us to advise when we are organizing conferences as a society?
Well, it's a token and it's a tangible way of showing that every action, every choice that we make in our lives, we can consider the impact in terms of finances. If we're going to go buy anything, we check the price. There's also the price in terms of the environmental impact. And so I like to think about it as how do we try and align the choices that we make in our home lives and in our professional lives. And the more we can do that, I think the better. At the same time, we need to separate out what might be performative actions. If I put a bumper sticker on my car, but actually then don't actually do anything, then I'm it doesn't have the impact. So it's an opportunity to show as a radiology society or as a institution or department that we care. And I can tell you, when I was chair of radiology at Vanderbilt, we would assemble some bamboo spoons and knives and that kind of stuff, and we would give these as gifts to our visiting speakers, our visiting grand round speakers, and it's a memento then that we care and that we can then share it with others.
Thank you so much. Thank you. And it's a general question for everybody, and it has just come to my mind that the greatest consumption in any radiology department is that of the ACs, and the air conditions do have their own fair share of giving out the greenhouse gases. So is there a way that we can redesign our imaging suits, our entire departments in a way that the non-essential areas do not use ACs, and is there a way out, or are we thinking too many things?
Yeah, I would be happy to speak from the scanner design point of view. I think a trend in the modern scanner design, we are trying to minimize the heat generated by the scanner. So the reason that a lot of hospitals require very powerful AC is that we need to use water cooling, for example, in Maryland, in some of the modern PET-CT as well. Water cooling takes a lot of energy and it gives higher requirement for the AC. But with a lot of the integrated circuits technology, new material, maybe it's possible to minimize the heat generated by the scanner so that we can use just a fan to cool the scanner down, or totally just get rid of the cooling system, just let the scanner cool by itself. That way we can kind of minimize the energy requirement in the scanning room. But of course, it's really up to everyone's lifestyle in the reading room, what temperature you like when you are reading an image.
So
Thank
this
you.
is very interesting because during COVID, ventilation was a big issue. And one of our big hospitals here, who was the main flagship hospital managing COVID cases, actually opened their doors and windows for the ventilation issue. So that is another question and comment that has been passed by a medical physicist friend of ours was that we are making our rooms too cold. We don't need to be that cold. So I don't know how Japan does this, because I know Japan is very energy conscious, and in summer, your air cons are not running full blast.
Yeah.
Am I correct?
Actually, the air conditioning, the temperature is a little bit higher than usual other countries. You know, when I go to the international conference outside of Japan, then the room temperature is very, very low, so that I feel cold. You know, so I mean that I think that's the appropriate that temperature is a very good things, and especially in summertime, like in Japan and other Asian countries, they're very hot, and then cooling down uses so much energy. So we need to to some extent tolerate to the temperature. This is what we are doing in daily life actually, and and also regarding the whole building, the construction of building. Probably we use energy to cool the machines, but the cooling machines makes heating actually. So I think that not only ventilation, but also the circulation of the heating, or some kind of the planning the facilities will be very important. So there are many stakeholders, like the general constructors or machine vendors or air conditioning makers and so on. So the comprehensive planning for efficient the energy use will be critical, and also the absorbing the heating and will be used some the energy will be also one way to do so. It's just very huge project, I think, to make it very efficient.
It's not easy to get used to the heat, but I know my friend who was working there said he had to bring his own fan to the workplace because there's no aircon on. No aircon on. And another question to address some of the concerns of our membership is that if you have old equipment, right, and this is really for lands, and it's not updated with all these eco features, then would shutting down and all this really help, or are we damaging the older equipment?
I think from the scanner quality point of view, shutting down, turning it back on is totally safe. But one potential pitfall over there is when you need the scanner, how soon do you want the scanner in an action mode? So it would be really nice to make the schedule in a way that you can kind of time the power on time. For example, having one scanner always dedicated for urgent scans, but having a couple of other scanners go into a sleep mode or shut them off as soon as the last scan finished.
So the auto shutdown that the modern scanners have is really talking about how you automate the shutdown. Am I correct?
Correct. Yeah, you cannot set a timer in the scanner.
Right. So it's not like we can still do it if we set a timer, say on a whatever we use for cooking, for example. You know, we set a timer how long we have put something in. So that's another way in which we can get around it, a lower carbon footprint way of doing things, because many people won't be able to upgrade their scanners to the latest eco-friendly design unless they are in the buying cycle now. Thank you very much for that confirmation.
Sure.
Thank you. I don't think there are any more questions, but I would like to request Vidoctor to share the feedback QR code once again for everybody. And if there are any specific questions for the speakers, please do send it to us and we will bounce them and get back to you. That's really nice. And before we leave, I think I would like to share with you, we have an upcoming webinar of Asia Safe, that is enhancing optimization strategy in radiological practices and optimizing those in IR tools and techniques, that is scheduled on the 2nd of August, Saturday. The times across US and Asia Oceania are displayed on your screens. Thank you so much. I would like to take this opportunity to thank the leadership of AOSR in helping us going ahead with this first webinar. Thank you, Dr. Chamari and Dr. Evelyn, ma'am. I would also like to thank our distinguished speakers, Dr. Reid Omary, sir, Dr. Hideki, Dr. Lance, and Dr. Evelyn for sharing their insights on these first steps for sustainability in Asian Oceanian countries. I would also like to thank United Imaging Healthcare for powering us and supporting us in this movement. I would also thank Vidoctor, our online platform, in helping us showcasing this. It has been a really lovely evening for me and a morning for you. In fact, a lovely weekend. And we are feeling so inspired to take new giant leaps towards sustainability and making Asia more sustainable and leading the way. Thank you, everyone. Have a great weekend ahead. Bye-bye.
Thank you.
Thank you.